It's Dr. Karthik Ram. Welcome to my podcast. I'm a board certified plastic surgeon and educationalist based out of Chennai. I'm really honored that you have taken your time and given me your gift of your attention. Hope you are going to love this session. Please follow me in my Instagram handle for more updates. My Insta handle is Ram Dr. Karthik, RAMDRKARTHIK. Enjoy today's podcast. This is the Plastic Surgeon Diary, the episode 5. We have a lot of interesting things to discuss. Before we start our Plastic Surgeon Diary today, we have a very interesting, famous Carnatic singer here. So she's going to start with a very nice song. And
गाइये गणपते गाइये गणपते जगवंदन शंकर सुवन भवानी नंदन गाइये गणपते मोदः प्रिय मुदु मंगलदाता विद्यावारिधि बुद्धि विधाता मोदः प्रिय मुदु मंगलदाता विद्यावारिधि बुद्धि विधाता मांगत तुलसीदास कर जोड़े मांगत तुलसीदास कर जोड़े बस ही राम सिया सिया राम राम सिया बस ही राम सिया मानस मोरे गाइये गणपति जगवंदन शंकर सुवन भवानी नंदन गाइये अब गाइये गणपति.
Thank you so much. எங்களுக்காக நீங்க பாடினதுக்கு ரொம்ப நன்றி and see you soon. Okay. Okay, guys, a lot of interesting patients for last 10 days, and this is a recap of last 10 days patients, and we learned a lot, and we see a lot of interesting histories. We gave them a lot of counseling sessions, and we did a lot of surgeries also. Dr. Joyce, welcome back.
Welcome, sir. Thank you. So yet another episode of Plastic Surgeon's Diary, and I think this time it started off very interesting with some nice music.
Correct. She is a very famous singer, but she doesn't want to show her face. That's fine. But anyway, we also enjoyed her song, and from there we are starting our Plastic Surgeon Diary. Yes, Joyce. Can you start with the disclaimer?
Yeah, so we talk a lot about our patients and discuss about their history, but we make sure that we don't reveal their identity so that their identity is completely masked. So
Yes.
the first interesting case which we want to talk about this time is most of our patients come alone. Some of them come with their relatives, their family members. One common scenario is husband and wife. This becomes a very interesting consultation, but very sadly we see that many times the opposite spouse is very critical. So this time we had a couple walking in. The consultation was for rhinoplasty, and it was quite clear that the girl was not interested. It was more by the husband who was forcing her. So Dr. Karthik would like to elaborate about it and tell you in detail and how he handled the situation, and how he actually made the husband realize that his wife is completely normal. Dr. Karthik, please tell us about this.
Yeah. See, I can say that this is one of my best consultation I ever done in my whole career. This wife and husband is probably like 1 or 2 years since time of marriage, and wife was so frightened when entering into the room, consulting room, and husband is so curious The curious look was there in the husband's face. They both sat, and at the middle class, like normal South Indian family. And when the husband started the talk, he said that we need that alar base reduction. That is very like specific term. Usually, that lay people don't use it. So this guy has done a lot of research, and she felt that wife alar base has to be reduced. So I asked wife to remove the mask, and I examined her nose, and as soon as I saw her nose is absolutely almost normal. We can do few things, but it's almost normal. Face was very slim, and I know, like, nothing to be complained about. So I told your nose is perfectly normal. I don't think you need to do anything about it. Immediately, Mr. Google educated him. One of the plastic surgeon is commenting that Mr. Google educated him. So immediately, the wife's face turned bright, and she was very happy to listen. That like I said, that your face is looking absolutely normal. So somebody is commenting that she doesn't need a rhinoplasty but new husband. So true. So next thing he started, uh, it's like it's yes or nose. I agree. Actually, might be okay. The lip, you can do something to make the lip all right. So I think that lockdown made them keep looking each other so often, and like keep criticizing the wife with various complaints like this. I said, if I need to create somebody's face, I always select the face like your wife only. She's perfectly all right. I don't find even a small bit of doubt that your wife's face is something abnormal. So I told that, and immediately I turned to him and I said that I think your nose looks a little abnormal. We need to correct your nose. That's what I feel is a problem. I think your nose is chubby, that is bulbous, and your nose bone is broad. I think you need to correct it. Wife was extremely happy, and she is kind of, like all the teeth are visible after that. Like when I start saying that, and this guy got very tense. And finally, what happened is when she left, then like the consultation over, and they all left. When she left, what she did it, she like thanked me like this and went. This is one of my best consultation I can ever say. I like that makes us really happy.
Yes, Dr. Karthik, two things. Very
Thanks,
interesting
Nega.
in all
Nice
of this.
counter. Yeah, a lot of people are commenting about it. Nega is commenting. Nice
I'm
counter.
sure
Yes,
husband
really a
and
nice
wife.
counter.
I'm sure husband and wife topic will trigger a lot of comments from all over. So the interesting part of this consultation is at no point of time did the lady reveal that her husband is the one who's complaining. And even towards the end, when she was so happy, it was not that she expressed thank you for what you told my husband. It was everything was based on her expression, her facial expressions, her eyes, the way she was, acknowledging whatever the husband is saying. So that is very important. That is what I could see, that it's very important when the patient walks in and when they're talking, that you kind of see their entire body language, their face language, how their eyes are expressing. You need not always expect them to, talk out with words. So that was a very nice analysis by Dr. Karthik in that issue. And I think he helped that family a lot. And another thing which I would like to mention, Dr. Karthik, as part of being doctors, and especially in this profession, we are also educators. Educators with respect to looks, with respect to this cosmetic surgery, and you have actually rightly educated the patient. So that's hats off to you.
Thank you.
Now coming to the next case scenario. This is a young girl, very sad. Actually, both of us felt very sad hearing about this girl's entire situation. So this is a person who never has an opinion of herself, but she's always following what others have to say. So she's gone through repeated surgeries. Every time it is based on the comments that people around her have given. And finally, she's landed up in such a situation that she cannot revert whatever the surgery which she has undergone in the past. And she came to us asking for help. So, Dr. Karthik, please tell us about this patient.
See, she's a young girl, and her friends usually bully her, saying that your face looks round. So it disturbs a lot. See, this is another message here. please, every plastic surgeon diary, we are insisting that bullying, how much, like that if an individual person gets affected, how much they go in depth to correct those issues. So never bully, like even for the just for fun, don't do it. So because of this bullying by the friend, she went and went for not here also. She went long distance. Like she went to Nagarcoil and get that surgery done. She done a bone surgery for the jaw as well as that lip. They lengthened the lip, and a lot of like bone work was done along with some facial work. Okay, so there's a buccal fat pad removal. A lot of things was done. So after which she came back from that hospital, and actually the look was really good. The surgeon did a good job, no doubt about it. But what happened is the parents keep telling that your face already looking good. Now it becomes very bad. Why you did it, kind of, like then what we did is then it disturbed her. It's a lockdown period. Also, every day as soon as she gets up, like parents used to keep teasing her, telling her that the old face was looking good. Why you did it? Okay, so it disturbed her a lot, and when she came to us, she said, remove the fat, they fill the fat what they have taken out. Okay, because the bone work cannot be reverted. Now she asking for the fat transfer because already they removed the fat from the buccal cheek fat. So we are also trying to convince her that your face looks really good, they've done a good job, your face looks slimmer, why you want to change it? Then we keep counseling about the self-love. See, you have to love yourself. Nowadays, the girl, what the problem she has is she always go with the opinion of others. She never had her own opinion. Like that's a major problem. What she likes, she doesn't know. What parents, Anmol is saying hi to you, Dr. Joyce. Anmol, I heard a lot about you through Dr. Joyce. Nice seeing you here.
He's a very dear friend of mine and a very nice person. Hi, Anmol. Thanks for your support.
So that girl doesn't have any individual opinion about herself. So I try to convince her a lot, and Joyce also spent a lot of time in convincing her, saying that it's normal, but we couldn't achieve anything. So finally she said, I'm coming tomorrow, do the fat transfer. Okay, so we did a blood test. 26-year girl, blood test. I had no other like comorbid factors in the family also. Her blood sugar is really high. So we are trying to make her understand your blood sugar is high, so that you have to, not very high, it's a borderline high actually. So we said we need to put you on insulin during surgery. So she's willing for everything. So we did the fat transfer. When we'll keep asking to come for the review for like follow up reviews for monitoring her blood sugar. She never turns up. Once in a while she comes, and even we ask them to go to diabetology. The sad part is the amount of importance she has given to the facial issues. More than that, the serious issue is she's diabetic. She's not even ready to accept it. She's not even ready to go and meet a doctor, diabetologist. It's really sad. The
Dr. Karthik, you have to tell us the value. You have to tell us the value of sugars, the recording, the repeated recordings.
Yeah, you tell me the values. I don't exactly remember, Joyce.
Initially, before surgery, it was actually borderline high. So it was somewhere around 160. We decided to take her up after the anesthetist opinion. And post surgery, it was 300. We kept her in the hospital. We were monitoring her sugars. It came down to, less than 200. And we still wanted to keep her overnight, but she refused. She wanted to be discharged. And post surgery, when we asked her to monitor her blood sugar levels also, she done it on few days she did, but it was constantly high above 200. She was on medications, of course, but the seriousness that we expected her to show wasn't there.
That's really sad in the younger generations, like they not taking serious issues as a light, and non-serious issue is a major issue, like it's very difficult few times, and finally that girls, no complications, we manage, but sometimes we feel bad operating on these people, because when they don't follow, we might, like the even fat might get infected, and we might need to do the revision surgeries to correct this, so sometimes we need to be careful in selecting the patient. And this patient is finally happy, no complaint till now, but we don't know.
Yes, 2 shockers. One, she reverted her face to such an extent that she did bony changes, which are not reversible. Second, she was detected diabetic during surgery, and she did not even have the concern to take precautions regarding it. So shockers for us. But though we try to help her out, it's difficult if she cannot take the help.
Correct.
Now, coming to another interesting set of surgeries that we do, that is, male to female or female to male gender transformation. So we had a young female patient who's always been so, and she wants to undergo a gender transformation to male. And she had the first set of surgeries, that is double incision mastectomy for the breast to remove them. And the entire, even during the consultation or surgeries, the most rewarding point was when after surgery she woke up and she showed that psychological relief and she expressed it. Dr. Karthik, can you also share about this patient?
See, the problem with the transgenders, that the becoming trans men or trans women, like their body, whole body, the mind says that, this is not the gender I'm supposed to be. They every day they feel very sad about the whole issues, and they kind of, get disturbed because of this bodily appearance, what happened after the puberty. So, we've spoken a lot about this issue, the transgender issue. So we have to understand, removing the, when we removed the whole breast and made it flat, the amount of happiness. I asked her in the rounds, you remember, Joy? I asked her,
Yes.
you feel like something, you relieved from your big burden, right? And it's as if like you dropped some burden, kind of, right? Kind of, exactly, doctor. That's what she told. That she feels that holding the breast in the chest is a big burden in her whole life, what she's doing. The other sad part is, though the technology is advanced, a lot of information is available everywhere. She is well educated, in a very good position, but she doesn't even know how to start, where to start. She came very raw to us when she met us maybe 6 months back about these issues. Then I put her into endocrinologist, and they started the hormonal things, and now she came for the surgery. So a lot of informations are there about it. Even the parents are not aware. Even the people who are suffering also not aware. And I think it needs a lot of education in our country.
So education doesn't just mean it comes from one side. So as much as we educate our patients, they also educate us. We had a very interesting young boy who came for a nipple reduction surgery, and he left us by teaching us few video tricks, and it came very handy. We actually put up his nipple reduction surgery through the video trick that he taught us, and that was a big eye opener. It was an eye opener for me. I'm not so tech savvy, and I thank that patient a lot for what he taught me. So that is something which I wanted to mention. I think Dr. Karthik, you also remember.
Do you remember what he taught you?
That time relapse in videos.
Okay, even I have done time lapse in various other things. I used to take a traffic and stand there, and I used to capture it from my house. And I never tried it in the surgery. But after he said we keep doing the time lapse often, and he said put it in time lapse and take the whole video, doctor. It will be very good. Nowadays youngsters are more open, and the earlier days, even if you say that actually put it in Instagram, a lot of resistance is there. Nowadays people are very happy, and they say that no problem, doctor, you put it in Instagram. Then they give idea also how to put it and how to do the editing, because that guy is a visual communication guy. So he gave a lot of ideas how to do it. So not only here, even a lot of times we learn a lot from the patient. This is a video trick. Even sometimes some patients Google a lot. Like when there is a problem for them, it's a big thing for them, and they try to do a lot of Googling, a lot of learning. In fact, sometimes they come back and ask me, doctor, you know about it. Sometimes I said, I don't know about this. I'll go and read, and I'll come back. And I learned something new which I never know till that time. A lot of times it happened, and I learned from the patients, and thanks to all my patients who kind of educated me a lot.
Yes, thanks a lot. And I would like to thank that boy, because we were trying to do a regular video. He taught us that this could be, something very interesting way of putting it. So thanks a lot. The next case scenario, patients should be ready for surgery only if they are mentally, physically capable of handling it. And this is something I think Dr. Karthik would agree, because he had a very difficult experience this week. seeing a young boy comes from such a far off place, and just because of his anxiety, he had to cancel the surgery. So, Dr. Karthik, please tell us about that patient.
See, a lot of patients, they don't come for a consultation. They send the photograph, we'll consult online and we'll explain everything online. And we have a lot of ready-made videos also. For each condition, we have videos. We'll make them understand. This is how we do the surgeries. This is the pre and post surgery instruction. This is how the results going to be kind of. All those things we explain. Our WhatsApp consultations are more than our regular consultation, but surgeries happens regularly. That's a different story because of the WhatsApp consultation. This guy was consulted through WhatsApp a lot of times, and he's very happy about the consultation. And he came for a surgery directly from far off place, lip reduction, the local anesthesia. He was so panicked even when I see him the first time entering into the room, the photographic room at that time itself. And I keep explaining, don't worry, the local anesthesia, simple injection only, and you'll be fine. And these are all the things, the swelling will be there because I'm meeting him in the first time. So I want to explain. I'll do a regular consultation one more time because a lot of miscommunication happened during that time. So I was consulting him and I once when I start explaining, his face turned kind of blank and suddenly he said, doctor, I feel giddy. I want to lie down. It never happened in my life. During surgery or after surgery, I understand, but even when I start explaining, he kind of started fainting. Then we made him lie down for some time, and I told him, "You're not ready for the surgery, so better you cancel the surgery, and this is not a major thing for you because you're not strong enough to understand the surgery pros and cons. So we cancel the surgery." So we canceled the surgery and sent him back. See, the cosmetic surgery, though we made it look simple, but it is a surgery. We have to give important, like the same complications, like we do all the precautions to prevent complications. Sometimes complication might happen. We need to manage it. Like the person has to come to us for surgery when it really disturbs them so much, so that this is a worth risk they're taking. Like this is a risk worth taking. That's what they have to understand. So. Then only they have to come for a surgery. So otherwise, they should not even attempt to go for a surgery unnecessarily, like thinking that's a very simple thing.
Especially when we're doing local surgeries under local anesthesia, if the patient is anxious and is saying something like they'll faint if they see blood, it's very difficult to carry on with such a scenario.
What is the next case, Dr. Joyce? Anything interesting we had this week?
Our center is very well, equipped with a lot of cameras. So Dr. Karthik keeps watching a lot of interesting things that keep happening. Whether it is some random patient who's crossing by will come and use our bathrooms, or whether it is some patient who's happily taking a smoke outside. So listen to the next interesting situation where a patient had to go through surgery and we caught him smoking. So Dr. Karthik, I think I wasn't there during this situation and you told me later. So tell me what exactly happened and how did you catch him smoking?
This guy also came from long distance. This is also a lip reduction patient only. We got few lip reduction this week, but every day cancelled for some reason. One trainee used to come and just during the early morning hours. Because he's doing a postgraduate super special degree in medical college here. So every time he come and say that doctor, I want to see the lip reduction surgery, that day it got cancelled. 2-3 days it consequently happened because he couldn't see any lip reduction surgery that time. So this guy came from far off place and we took photograph and everything is ready. I see him in the camera. He's smoking outside just before the surgery. I called him and I said that we said a lot of videos, pre-operative videos, clearly instruct them 3 weeks you have to stop smoking. That too, lip reduction. How will you do a lip reduction? Then we can't make him understand. I've seen a lot of videos and we never said everywhere. But we know what we are sending and we know like what is the material we are giving to them. The patients are not taking it seriously, and when I said him, like, if you do the surgery, you'll end up in a lot of complications. He's ready to face the complications. He want to do it now itself. Then we slowly convinced him and send him back. But people have to understand any skin surgeries, any plastic surgeries, in fact, Smoking is a very dangerous thing. We always tell our patients 3 weeks they have to stop smoking for sure before surgery, and after surgery we normally say completely stop smoking, because why you want to add on to a like complication. Even the small surgery like a plastic surgeries, these so much complications. You're ending up in emergency, and a lot of future issues like infertility issues, a lot of thrombosis, a lot of complications happen because of the smoking. So we strongly advise him to stop smoking after the surgery.
Yes. Now coming to the next situation, uh, when we when anybody is supposed to analyze themselves, I think you're supposed to pick up what is quite obvious. But most of our patients sadly pick up what is very much not obvious and try and correct it. But what can actually alter and make a huge difference to their health, they neglect. So we had an interesting situation, mother and son walking into our evening OP, and the next thing is situation was very interesting when both of them started fighting. The mother was trying to convince what is obvious, and the son was fighting for something which is not obvious. And what is not obvious, Dr. Karthik will tell you.
See, the son came and he's maybe 30 plus, 32, 33, and not planning to get married. And he's obese, and everywhere loose, flabby skin everywhere, and the chubby cheeks, and like hanging cheek. In fact, like obese people that how the cheek hangs, same way, like everywhere fat deposits. One thing I never expected him to ask is he asked for the ear correction, because that is least visible in the whole body, in fact. Okay, so he asked for the ear correction, saying that bad ear, I have bad ear, you correct it. I asked, why you want to go for it? No, from the beginning, I have this kind of issue. I'm feeling bad about it. It's not too bad also. We can correct, but it's not too bad. The purpose why he came to us, why the mother is convinced to come to us, because most of the mothers don't like us. Because we do surgery, so they don't like the son or daughter to undergo. So so I got confused. Why you want to go for it? Then he said from the school days somebody bullied me. That kind of some stories that he said. But I made him understand. You lose 10 kgs and come. I'll do the surgery for you. Till that time, no surgery. So we'll send him to a dietitian to lose weight and come. Then we'll do surgery. Then he agreed. Actually, finally he agreed, and he got convinced. He said within 2 months I'll come and meet you, doctor. You had to do the ear surgery after I made 10 kgs weight loss. Sometimes these kind of we have to put like what patient like to do. No, we'll give like how we giving a chocolate to the babies to do something like that. Like we give them this surgery as a chocolate to make him lose weight. Sometimes it happens.
Yeah, very important. I think with respect to his health, that was a very important juncture. Also, he's 35 or 36, late 30s, the time when all the metabolic issues start setting in, and you get diabetes, hypertension. Right time to lose weight. So another person, very nice young boy, walks into the OPD. We thought he's very content with himself, and then he's into the acting profession, and it's very nice what he had to discuss, but also few things which he's not understanding. So Dr. Karthik had to make him understand about it. Dr. Karthik, I think you remember this patient. I'm being very vague, but I think you know.
He came stylishly wearing some that kind of like bunny and open shirt, something like that. And he's IT guy, but he's into acting, and he wants to. Like this the worst patients. I can say that no, we can't say worst patient. The patient who never you should not take them for surgery is this kind of a patient who come to your clinic and show your face. Doctor, you tell me what are the problems in my face, and try to correct the issues. I'm ready to go for it because I want to improve my face. The person who doesn't know what he wants or she wants is a very bad person in a cosmetic surgery. We should not even select it. Unless otherwise, the guy like him acting, like sometimes camera say that this kind of issues, even those people come with the issues properly. But when they don't know their problem, you should not even touch them. It's very, very
yeah, the wrong patient selection.
A wrong patient. But this guy was little sensible, and he is entering. He wants to correct before he goes, so that in between it's not a problem. So I said, you're looking perfectly fine. More than that, like the guy's acting is a main important thing. Ajay, thanks Ajay for watching. We'll keep telling you a lot of interesting stories. Please stay back. So
Thank you.
the act in acting, the guys most of the time they see that acting. Even the females sometimes they like look for the beauty and other things. And males decent looking and good acting, you will get the chance. But you have to wait patiently till you get the proper role, because they even not only guys, girls also, they go to a director and they ask for a they will be rejected. They feel that because their face looking good, they got rejected. They even for they are rejected because they are not suitable for the particular character. So when the opportunity comes, you get it. Sometimes, yeah, you might need to wait for a long time, but don't think that because my nose is not good, even they haven't told anything to them also. But they themselves feel, okay, nose is not good, I am coming for the surgery. You do the surgery, or like lip is not good, something like that. They come to us, but that's not a correct attitude. So I convinced them acting is very important. The guys, don't worry. So you go back, everything looking normal. So don't go for a surgery. Even one plastic surgeons earlier said, cosmetic plastic surgeon said, the patient whom we reject is the best consultation we always get, we always do. Actually true. That's correct only. So we send him back. So this is advice for any media people in the media. Don't think that your facial features are not good, or that is not good, this is not good, because try to understand what is good in you, what is your plus points. Try to project the plus point. Don't worry about the negative points. The example, negative points are so obvious. Example, crooked nose. You want to, everybody asking about it. These kind of things understandable. Minor things. Even now, one girl wanting to go for one milder correction in the face. Don't even we can see it. Okay, it's not even visible at all. Very mild. Maybe a little bit Botox will help. Okay, she's sitting on her head. Make sure that we are doing it. Okay, sometimes very disturbing. Even I removed my mask and said, see my face, one side face is completely different, other side face is completely different. Even I don't even think of doing it. Why you want to go for it, kind of? But difficult to convince sometimes.
Talking about this media profession and lot of actors and all, sir, I'm sure you've had a lot of experiences with actors and actresses. And some of your experiences you've shared with me, they're very interesting. Would you like to tell us few?
The worst experience I had is a very famous actor from Tollywood, Telugu film industry, and very famous actor. I did a first facelift long back, maybe 5 years back. I did a first facelift, and few years before the lockdown, he came here and asked for the little more extra correction of the facelift, re-facelift, second facelift. Since I did 7 years back, okay, I know okay how I did it, so I'm confident that okay I can do a second facelift. Almost we are Dhanasri is going to intubate. I saw others. See, I know how I make a scar, but the scar is little different. I was little confused. I didn't make this scar. How it happened? Do you have any injuries or something like that? I asked. He said, no, doctor. In between, I went to France and I underwent some surgeries there, some facelift, my mini facelift. They said I did the mini facelift. This guy, so much famous actor, not even like have a basic knowledge to tell the doctor what he has underwent in between. How much is important during our surgery when you are doing a second facelift? How much like difficulty if I face when he's not revealing that history to me. Actually, I canceled the surgery. I didn't do it. I sent him back because these kind of patients are dangerous patients. When something happened, it'll be a big news in the media, but like they don't know what happened really. So I advise him, I'm not happy the way you did it, so I'm canceling the surgery. I didn't do it. After that, he comes with some Botox fillers, but I don't do that. He flew all the way from Hyderabad here and get it done and go. But I never did any surgeries afterwards.
So this is the downside with most of them in the media profession, is that they don't reveal the history. What they've gotten done with you previously, they'll tell you, but in between what they've done with others, they don't want to tell. And I think they say no doctors and that you have to be completely honest with. It's for a reason, I think, that they're telling. So patients should start taking that seriously. This is the downside, but there are also some positive things, right? That you've experienced.
Yeah, of course. See, one more major problem with the actors and the models. They never come on time. Okay, if she say that 9 o'clock is the OP, morning 9 o'clock is the OP, they'll call it 10:30 and ask, I'm starting from Tambram, shall I come now? It's almost 1.5 hours travel time. You know, that is the kind of attitude I really hate in my, because they don't value our time in a lot of actors. But even a senior actor who is now is a very senior actor, but that time is very popular. Uh, I did six pack creation and few other things, and he's happy with the result. And that guy, you don't believe, if you say 12 o'clock sharp, 11:55, he'll be there. Okay, I always wonder, because of that kind of a punctuality and sincerity only, they are in that higher level. You know, like the younger actors have to understand. See, please try to value others' time. That's very important in any profession. If you say 11 o'clock appointment, you know, like even the international patients, when they are coming to us, they'll be on time at 11 o'clock. Our Indian clients, if you ask, doctor, heavy traffic, doctor, half an hour delay. Even for the international client, that heavy traffic is the same. But our attitude is, we have to change our attitude. It is in our blood. You know, like taking, it's not, you know, like we are not trained that way to, you know, like make others' time valuable and other things. So, but try to, at least to us, try to keep our appointments on time, and please come on time. And because even surgery, you know, we start at 7 o'clock or 6 o'clock in the morning. When we say 6 o'clock, not only me waiting or Joyce waiting, other four staff will be waiting, anesthetist waiting, other, you know, like technician waiting, almost 10 people's time you're not valuing. That is very bad. Even, you know, like when you're coming, otherwise when you're coming late, what happens is we have to rush you to the surgery. So we miss few things in the, you know, like taking the history. You should have forgot to say what is allergic to. You know, like a lot of things can happen. So only we ask you to come 1 hour early before surgery. So some people are very punctual, some people are not punctual. Make sure that you're punctual. That not only in this surgery, your whole life will be, you'll be successful when you're punctual.
So I like to share something. It's actually quite a coincidence, since you're talking about discipline and being on time. One of my professors just joined this live session, Dr. Prithvi. So he's a highly disciplined person, and that's something that I've admired in him, and he's enforced in all of us during our surgical training. Him and the entire surgical department in Father Muller's, where I got trained, hats off to them for all the discipline that they have taught me and the rest of my batch, as well as all the other surgical residents. So thank you, Dr. Prithvi. So this
Dr.
brings
Prithvi,
us
nice
to
meeting you here. Dr. Prithvi, nice meeting you here. Even the same way, my surgery professor, Dr. Prem Kumar from PhD Medical College, when I was trained in MBBS, 7 o'clock in the morning, if I see him in the ward at 7 o'clock, so if I see him in the ward, I can say that it's 7 o'clock in the morning. So punctual, 7 o'clock he starts the rounds. Maybe we started
so he's a
career
walking
seeing,
clock.
yeah, correct. So sincere, because we are all trained with these people, probably we all tuned that we don't know.
Yes, sir. So this brings us to the end of the discussion of the patient scenarios this week. Dr. Karthik, I would like to remind that there was one message that you want to put across to all our gyno patients who are coming for consultation. There was one who came from far off.
Yeah. See, the thing is that gynecomasters, nothing much to examine in person, because you send the photograph, chest photograph, front and side view, because we get all over the world. Now all over the India, we're getting the clients for the gynecomastia. What they do, they take the chest pictures, front and side view, and send by WhatsApp to us. We'll examine them. We'll give all the details, because I have a lot of video information. I made the videos and I make them very clear about the gynecomastia, all the Q&As, everything we send it to them. They listen to the video and they understand everything. They come directly for the surgery. See, coming from far off places during the COVID time, just for a consultation is really waste. Even one guy from Coimbatore, he came all the way just for a consultation. I don't think it's necessary. If needed, if we are little doubtful, we ourselves tell, okay, better you come for a consultation in person like that. During this COVID time, better not to come for just a consultation. Especially the gynecomastia, few things, just nose or a face or few things, and we are in doubtful, we ask you to come in person. But when we are clear about the gynecomastia, we do at least 2 to 3 surgeries, and most of them they come from other places. In Chennai, probably if I do 3 surgeries, means 1 from Chennai, other from 2 other places. Joyce must be noticing all those things now. So Never just come for a consultation far off places, just for consultation, and send the photographs, and we make everything clear. After that, you come directly for a surgery, especially the gynecomastia. Thank you, guys. Thank you, Dr. Joyce, for the wonderful
Thank you.
session today. Actually,
Thank you, sir.
we loved this session today. Actually, I can say that is one of the best sessions of plastic surgeon diary till today, and because of Joyce only it's happening. Joyce make it very lively, and like she's guiding me properly. Otherwise, I don't think I can do this. Thank you, Joyce, and
Thank
we have
you
seen
so
you a lot
much,
of
sir.
your
That's very
professors.
humble. That's very humble
Thank you
of
so much.
you. Thank you, guys. That brings us to the end. Thanks for joining.